Hey, welcome back to Teaching Tuesday. I don't know how many times a day we have patients say, that they want their eyelids done or they look tired or that sort of thing. And the question comes down to, what do they really want? What do they need? Is it upper eyelid surgery, which would be great because it's simplest, or a brow lift? So here's the way I try to break it down for the patient. A patient like this, right, you can see the extra skin here and not much hanging down on the side, suggesting the whole brow has fallen, can do nicely with just an upper blepharoplasty. Eyebrows still look in a rested position, not bunching of skin here or here, 45-minute procedure. That's great when we can do it. Some patients, though, have, maybe a patient already had upper eyelid skin and they say, well, I still look like angry or tired or sad. And what it has to do with their whole brow is down, and you can tell by the bunching of skin here and skin folding over here. So when a patient says that, this about their eyelids bothers them, I have to say, hey, that's not your eyelid because there's no eyeball out here, right? So it has to be that the forehead's down. So repositioning it is the answer. And you see, once we do that, she really doesn't have any excess eyelid skin, right? Now, another option is even a younger patient who comes in and they says, well, they're telling me, the patient says, I like this. And it's kind of just a higher brow or more exotic look, or a rotated brow look for a more chiseled, like I said, exotic look, like this patient. She really didn't have much excess, a tiny bit of excess skin, but what she liked was more when I pulled this way on the brow, gave it a little bit more angle, and she said, yes, that's what I want, is a more dramatic look. And so those are the times that we do brow lifts, which is more like an hour and 15 minutes, hour and a half, versus a simpler operation like an upper blepharoplasty. I hope that makes sense and sort of helps you understand why we do one sometimes and why we do the other times.